with our press events here. So, good morning, everybody, and it's an honor to be here today, and I'll keep my remarks brief because I certainly want to hear from those that will be doing the work. We're here to announce the Transforming Children's Behavioral Health Policy and Planning Committee. Sorry, I couldn't memorize that, but it is summer vacation. I'll be a little better maybe in February. And I really want to thank Representative Exum, who's behind me, and Senator Mara, who you'll hear from, who are going to be the co-chairs, along with OPM as well, is going to serve on that. But we're joined by some legislators. If I forget anybody, blame Alex or blame me, whatever you want to do, but don't blame Tammy, okay? This is her special day. I don't want anyone angry at her. So I mentioned Representative Exum. Senator Seminara has joined us behind me. Senator Austin, our Chair of Appropriations, is right there. Representative Belton is to my left. Representative McCarthy-Vahey, Senator Anwar, Representative Walker. I see Representative D'Amico hiding in the back. I still spotted you. And I know we have a couple of commissioners who are both going to speak as well. So I think I got everybody who's not speaking, and then you'll hear from the commissioners in a second. Let me just say that I'm really excited for this opportunity. It's really modeled in many ways after what Tony Walker has done for so many years at JJPOC. And when I was in high school, I was a terrible math student. And this is all connected, I promise. And my teacher, Mr. Lorden, used to joke with me because he knew I liked political science and things like that. And he goes, the problem for you, Ritter, is that in math it's right or wrong. It's 5 plus 5 is 10, and that's how we do it in math. And everything else is never that simple. Well, legislating is the same way. It's never as easy as just passing a bill and solving all of the problems. If it was that simple, we wouldn't be back every year. So it's not some mathematical or scientific formula that you can just sit back and say, we passed House Bill 5001, we did our job, everybody got to figure it out. Actually, sometimes it gets more complicated when you start providing more funding, allocating resources, and having to make decisions. And so I think what you're going to see and you're going to hear from this committee is exactly that, is that issues that are this complicated, that require funding, are solved in the hard work of the off-session. Weeks and months. It's listening to experts. It's listening to professionals, many of whom are here, on what our best practices. So then when we come into session, we hit the ground running. And then guess what? There might be stuff that comes out the next year. There's more studies done. There's more scientific research that you can base your decisions on. So unlike Mr. Lord and his math problems, this is not that. But the example that Representative Walker did, I think, hit the light bulb for the Vice Chair of the Appropriations Committee, who I'm going to introduce, who it is such a pleasure to work with. There is nobody in this building who has a bad thing to say about her. She has the lived experience, the drive, the heartbeat, as I call it, to really get under this and really try to figure it all out. And we're here to partner with you and take our lead from this group. So without further ado, it's my pleasure to introduce you to one of the three co-chairs of this committee, Representative Tammy Exum.
Thank you so much, Mr. Speaker. And thank you to all of the legislative friends and advocates and supporters, and to Tony Walker, who has really been an amazing mentor throughout this process, to those of you who have taken the time to come today and to show your recognition of this very important issue. I am touched to see you all in this room and to see that we've made it to this day. And with that, I just wanted to say that the pandemic may be over, but the children's mental health crisis is not. The pandemic may be over, but the children's mental health crisis is not. I've been really laser focused around this work. It has been an important priority to me. But you may ask, why is it so important to you? And I'd like to share with you, it's because I've seen the young children in the emergency department, in the hallways, because there was not a place to send them, not the appropriate plan or placement. Because I've had a conversation with my local superintendent, and I said, what is it that you really need if you could have anything you wanted? And he said to me, we need mental health beds and support so that our children, our students, can get what they need, they can get healthy, and return back to school so they can learn. I've talked to the parents who said to me, I'm looking for a provider. They're saying 6 months. I don't even have 6 days. My child is in crisis. I know what it is to have to take your child out of the state of Connecticut because the services they need are just not available in the state. And because I know, I've heard and familiar with leaving the hospital, really nervous with this young child, who needs your support, teenager who needs the support, waiting for that person, the coordinated care that's supposed to arrive to help you figure out your plan at your home, and they never arrive and you never even receive a phone call. I have seen those children and I know those parents, and that's why this is important to me. So today marks our continued commitment to building a comprehensive behavioral health system for the children of Connecticut. I think it's important to provide a bit of historical framework. So on November 9th, 2021, Speaker Ritter held a roundtable that highlighted the crisis within the children's mental health system, and where I was deputized to create and lead a committee to craft legislation at that time. Now, together with Representative Liz Linehan, who's the chair of the Children's Committee, Rep. Steinberg, who was the chair of the Public Health Committee at the time, Representatives Nuccio, Wielander, Pettit, Kristen McCarty-Vahey, and the amazing staff, we drafted a robust piece of legislation, House Bill 5001, coupled with Senate Bills 1 and 2, and Senator Anwar was very involved in that, and we developed Public Act 2247. This priority bipartisan legislation passed unanimously through both chambers and was signed into law on May 23, 2022. It was a major accomplishment, and I was hopeful for the impact that it would make. The final section of House Bill 5001 established this committee, and in the last legislative session, there were some technical revisions. One of these changes was the name of the committee. The revised title is Transforming Children's Behavioral Health Policy and Planning Committee. Now that's a mouthful, so we affectionately call it TCB, because we plan to take care of business. So this new committee name is aspirational, and it represents the hope of impacting and transforming our children's behavioral health system so that we comprehensively and collaboratively address the behavioral health needs of all the children throughout the state. In addition, the term behavioral refers to mental health and substance abuse, so it was really important to use that preferred title instead of mental health. This body will analyze gaps, utilization, continuum of care, data collection, best practices, sustainable funding, and more to inform our creation of goals, work plans, and policy moving forward in an inclusive and transparent manner. This committee will include a tri-chair leadership model with Senator CeCe Marr serving as our Senate chair and Claudio Galtieri serving as the OPM chair designee and myself as the House chair. We will work alongside our committee members, which includes various agencies and commissioners, some of which are here today, other legislators, stakeholders such as behavioral health providers and agencies, hospitals, advocates, members of other previously established task forces and schools, and individuals with lived experience. Our work will be organized, staffed, and operationalized by the University of New Haven's Tau Youth Justice Institute, an expert consultant, and a UConn Institute, which brings a national research perspective. I envision that we will come together to the table together with a shared goal of providing the absolute best array of behavioral health services to all the children in our state, recognizing that the pandemic highlighted a long-standing issue with which our Connecticut families have been struggling for too long. I can personally attest to this fact. This isn't a temporary problem that can be fixed with temporary funding. To create lasting change and to be transformational, to give our kids and families what they need and deserve requires the support and collaboration of all these stakeholder groups, their time, their expertise, their insight, and investment. While we have certainly moved from the peak of the pandemic, the needs of our children persist. With the help and support of this committee, I look forward to TCB, taking care of business. Thank you. And next, thank you so much. And next, I'd like to introduce Senator CeCe Marr.
Thank you. I really appreciate. I cannot tell you how excited I am to be doing this work. I come at this as the chair of the Children's Committee, but also as a social worker, as someone who has worked with children and youth in psychiatric hospitals, as a nonprofit provider that has worked to create better environments for children throughout Fairfield County, and as a mom who has gone through my own challenges with my own children along the way, as we all do as parents. The other thing that brings me here and that I think is going to be valuable is I'm a freshman senator. I wasn't here when 5001 was put in place, and I'm still learning the process. And when I hear DSS, DDS, DCF, but I know now, 6 months in, but in the beginning I was like, oh my God, and I'm considered an intelligent person. So how, in heaven's name, could a mother in enormous distress, or a father in distress, or even a provider who has a focus on the community that they're serving, how can they know how to find a pathway forward for children? So I think being a freshman senator brings a great deal of value to this, because I will be learning alongside everyone, and I do not have the preconceived notions about what is and is not workable. And so I hope with that information, I can help make sure that we take care of business. I am so looking forward to working with Representative Exum and all the members, all the providers that are going to be joining us in this work. And I'd like to introduce, oh, I knew I was going to do this. I just had a complete brain blank. Claudio Gualtieri from OPM. Thank you.
Thank you, Senator Mar. And thanks everyone for showing up today. It's my pleasure to be Secretary Beckham's designee and a tri-chair for TCB. It's my good fortune to go after my co-chairs, which means I could be really brief because they've just given the passion and charted the course for our work. But I will say a few things. First, I think with any emergency, I think emergencies like the pandemic do have a magnifying effect to look at our systems, both at the local, state, and at the federal level. And in that way, I think COVID did sharpen our public's attention around the needs, the unmet needs for children's behavioral and mental health. And I'm very proud that Connecticut stepped up to the challenge with the passage of 5001 and the resources that we put in the budget to make those a reality. So in addition to putting in hundreds of millions in new investments, we designed brand new service models and delivery of care. We started pilots and grant programs that really will be able to test our policy ideas and assumptions. But more importantly for me than the resources we committed was that we also committed to a process that this committee is all about, to actually honestly evaluate the investments we made and make thoughtful decisions on scaling and sustaining those investments that are actually very effective. And I'm just so grateful to be part of the embarking on that work that's going to happen later today and ongoing into next session for sure. And I'm also mindful of the fact that we're not doing so alone. We're undertaking a mammoth task, but we have the benefit of all the people in this room and an array of advisory groups, committees, and councils that have predated us and are doing fantastic stuff. So looking forward to working in partnership with all of you and doing some good work on TCB. And with that, I'll turn it to Representative Nuccio.
Good afternoon. Thank you for all coming and for listening to us here. Last year when we passed 5001, it was heralded as landmark legislation. And I remember right after the governor signing it, turning around and looking at Tammy squared here, and saying, okay, who's doing it? Who do we talk to? What's the next step? How do we make sure it's being done? And nobody knew the answer to that, because we pass a lot of legislation up here and then we just trust that it's going to get implemented and stuff's going to happen. And then when the budget came along, I remember sitting with Tony and Kathy and saying, well, where's the money for 5001? Where's this? Where's that? You know, where is it being spent? What's the balance? What have we done? What have we not done? So this finalization of creating this new policy board here, I think is exactly what we need. Because when we put 5001 together, we said specifically We're not just going to throw money at this. We are going to make sure every dollar that is committed to this is doing exactly what we need it to do. And if we're wrong and we picked the wrong thing, we're not going to fund it anymore, and we're going to find the right thing. So it was very frustrating the first year for not knowing where everything was and what was going on. But I know going forward, with all of us being on this committee and this board, that is not going to be the case. We will be on top of it. We will be looking at the dollars that are being spent. We will say, if you're not doing what we think you need to be doing or what the residents need, we're not going to fund that anymore. So I'm very much looking forward to working with this group and this committee and being a member of this again, sticking together, keeping the team together here. Got the band back together. But, we're going to really look at focusing on how we can truly help the children of the state of Connecticut. Just last week, I read that after 5001 has passed, in the last year, we have not added a single mental health resource where we needed it. The resources are still not there. And that's a bigger issue, because we need to find a way to get these professionals to come and move to Connecticut and be part of these networks and be part of these teams and get more kids graduating out with behavioral health professions, so we can amp up and have the resources that we need. So when I see that and I hear that, the very first thing I say is, all right, what do we need to change? How do we need to get them here? And how do we move it forward? So I'm a bit of a workhorse rather than a show pony, but I'm ready to jump in and get working and see how we go forward. So I'm looking forward to working with everyone on the committee and the professionals that are going to be there, and let's take care of business.
All right. And next we'll have our Commissioner, Vanessa Durantes.
Hello. It's great to see you all here. Children are best supported by families, and families are best supported by their community. Look around this room. The children who charge us to have their voices heard would be very proud to see you all here today. This is not an easy task, and I'm honored to serve on this committee to ensure that children and families across Connecticut receive timely and effective services. The establishment of this working group is yet another step we have taken to lift our children to reach their fullest potential. We know that there are points in time, particularly in Connecticut, where Connecticut has rolled up its sleeves in support of its children. The Children's Behavioral Health Plan was first developed as a result of the tragedy in Sandy Hook. Fast forward, now the pandemic has left children in this space of behavioral health crisis. And as the statutory agency responsible for children's behavioral health in Connecticut, I am here to link arms across branches, public and private partnerships. I see a lot of our private nonprofit providers here, municipal and state leaders here, urban, rural, suburban. This cuts across all corners of Connecticut. Some of the following supports have been added and enhanced to the existing array of services for children and families across the state. An expansion of the 24/7 mobile crisis across the state, now all hours of the day and night, including weekends and overnight. To access that, mobile crisis, EMPSconnecticut.org. Urgent crisis centers will be opening and available around the state in Waterbury, Hartford, New London, and New Haven. They're aimed at diverting children from unnecessary visits to an emergency department. Expansion of Access Mental Health for pediatricians. Pediatricians can have real-time behavioral health consultation between themselves and a psychiatrist. And if medication is prescribed, that pediatrician and psychiatrist can agree to follow up. Intensive transition care management and peer support staff assisting families and connecting to services, so there is not that need or uncertainty of what's next and what's to come. An urban trauma initiative, which is a network of clinical treatment providers, and is being developed in Hartford, New Haven, Waterbury, and Bridgeport. I saw two of the providers here, to provide interventions that focus on the impact of intergenerational racial trauma on young people, especially in communities of color. Respite for non-DCF families through a referral to care coordination and families of children with complex needs. As a reminder, infoline.org 211 and connectingtocarect.org are great resources for families to access supports across the state. This working group is committed to collaboration, and even when there's disagreement, consensus, and most importantly, care. Our children are counting on us, and they're watching.
I would like to acknowledge Representative Anthony Nolan, if you'll give a wave. Thank you so much for joining us and for your support.
She doesn't mention it.
Oh, I'm sorry.
That's okay.
And also, I'm sorry, Senator Lisa Seminara, who is also my senator out of Avon, and she's a ranking member. And thank you so much for joining us as well, of Children's and
Children's, Aging, Education, and
Aging,
Human Services.
Education, and Human Services. So thank you so much for joining us as well. Oh, and Commissioner Jitani, did you want to say a word? Okay, and we're going to have her come forward and say a couple of words. Thank you so much for joining us. Commissioner Jitani.
Good morning, everybody. So, just for clarity, Manisha Jutani, Commissioner of Department of Public Health, DPH. And, I was brought in initially for COVID, but as has been said many times over, the children's behavioral health crisis that we have is here and here to stay until we make a bigger dent in solving this problem. This morning, I was in New Haven, actually, at one of our community health vans sites with our deputy commissioners, Dr. Jody Terranova, who's a pediatrician and will be serving on this committee as well, and Lisa Morrissey. And we saw firsthand when people are coming in to get primary care, syringe exchange, needle exchange, and seeing how that is implemented in the community. But what we want for our children is to intervene before they need to access those types of resources. It is on us to try to find ways to interrupt that cycle, and the earlier we can do it, the better chance we have at allowing these people to integrate into our society and to become the full-fledged members of society that they want to be, and they don't want to get off course. And so we as the Department of Public Health, our biggest lever is in the area of licensure and capacity in terms of behavioral health providers. And what I can say is through the partnership with our legislature so far, we've already passed things with compacts, with reciprocity, where we have had more behavioral health providers who've been licensed in other states and been in practice for 4 years or more in good standing become behavioral health providers in the state of Connecticut. And this has been helpful. We've increased the number of compacts so that people who are licensed in other states can be licensed in Connecticut. And those are just first steps. But as we've heard, it's not enough. It's not enough. And I just pledge to you that as a Department of Public Health, we will work with you as a partner. I think having a pediatrician like Deputy Commissioner Jody Terranova on your group on a regular basis will be an additional great voice that we can add as a Department of Public Health. So let's get TCB together.
All right.
Thank you.
Thank you. So that concludes our speakers. At this time, if we are happy to entertain questions. Just to let you know, we had planned to take a little break before we get started on our initial meeting, which begins at 1 p.m. in 2C. Oh, we're into it. 2C. And we will have it'll be an introductory meeting, no more than 1 hour. But I told you, TCB, we're ready. We're ready to take care of business here. So.
Let me ask some questions.
For Representative Nuccio, when you spoke, you said we hadn't added a single mental health resource in since 2021 or 2020. It sounded like when Commissioner Tutani and Durantes were speaking that a lot of stuff was going on. So I just wanted to know if you could clarify that.
Sure. There was an article last week that talked about specifically in I can't remember the two facilities, but the juvenile facility and another one that we have not added any more behavioral health providers to. We haven't seen an increase in the number of behavioral health providers that are here. We may have some in the compact that are coming in, but actual providers here, according to that article, we hadn't seen any increases. And that's an area of concern because we have a shortage. Connecticut actually rates pretty high compared to other states for the number of providers they have for behavioral health. But as we're seeing, the demand is significantly higher than the supply. So finding ways to bring these providers to the state of Connecticut is imperative to me. Finding ways to actually have them be here, be available all the time. The compacts are good because they allow us to use providers in other states. A lot of that was through via telehealth and such. Actually having providers here on the ground and taking new clients is more of a primary goal of mine.
Since 5001
landscape for children since 2021? Are we looking at the same bottlenecks or is it different now?
I think one of the purposes of this committee is to look at the landscape. We want to look at what is happening in Connecticut, what is happening across the country, having the opportunity to compare why, what, when. That is what this body will allow us to do a closer analysis. So, okay.
One thing I could just offer is that starting in 2021, when we heard and were feeling that pressure in the emergency departments, there are some hospitals that came forward to us and asked to transform spaces that were being used for other things, or maybe for adult psychiatric care, for children's psychiatric care. And we provided certain waivers to be able to, as a Department of Public Health, to be able to open those beds and be able to transform them in some ways. Now, I understand, again, given the vast need, it may not still be enough, but there have been certain interventions like that at least we've done on our side. I know our DSS commissioner isn't here, but I know there's also been funding put towards other beds and other facilities to be able to help that as well.
Anybody else have any questions?
Thank you.
Any other questions? Thank you very much.
Thank you very much.